All right, well, because we've had such a great conversation, I'd like to continue a little bit longer so we can maybe take a look at some of the things you didn't get a chance to talk about. But I would like to ask each one of you, do you believe this is a public health issue? And Andrea, can we start with you?
Yes, I do believe it's a public health issue. I'm really big on prevention, so it sounds like everybody at this table is trying their best, but at this point it's becoming an intervention, because if it was a prevention, we would have had this conversation a long time ago, right? So yes, I believe it's a public health issue because our kids are not getting better. We have kids, as we saw in the video, that are taking their lives. So this suicide is prevention, so it is a preventable issue, but the experts here probably have other comments about that too.
Nancy?
Oh, absolutely. I think that Jenny and Dara can speak better to this, but anecdotally, I've seen it in my own daughter. You know,
And how old is she now?
Now she is soon to be 26.
And mine is 25, so I can relate.
So she started, they were like the first class at the end of middle school, beginning of high school to get that phone. And of course, we did it because we wanted to stay in touch with her. And then the phones changed. They became smartphones eventually. And I watched this carefully. And she's only 2.5 years younger than her older sister, who wasn't on social media like that. And just her attention span is very different. Her anxiety is different. I see it all. I see it anecdotally, you know, front and center.
I would agree with you. And Dara and I were talking beforehand, the fear of missing out, like watching what other people are doing online, and then you have your own life, which is wonderful life, but when you compare it, right? We talked about comparisons.
Exactly.
So let's speak to that and whether you feel like it's a public concern.
Sure, yeah. I absolutely think it's a public health issue. Without a doubt. And I struggle because, like as I mentioned, I've seen people struggle themselves with social media, but then the system itself, the way the mental health system is built in the United States, there's a certain process, especially with the American Psychiatric Association, and approving and like creating a diagnostic criteria, and that hasn't happened yet. And so as a researcher, we're kind of like stuck in the middle, and I can do my research and get it out there, and hope that that these things the research gets integrated into the decision-making process for either they might come out and say, no, we don't think this is an addictive disorder, or we do, but at least we need to have some type of judgment, something being made by the American Psychiatric Association, which they haven't. They basically define all the psychiatric disorders in the United States. So not a lot of people don't know that. So it is a public health issue. And then speaking about the comparisons, we evolved to care about what other people think about us, and we compare ourselves to others, and we didn't evolve to have a lot of people, like to be looking at a lot of people and their achievements and their best days all at the same time. So like as we talked about, like let's say like before technology, if you and I were talking, you could say, oh, I went on a vacation, and I would say, oh, cool, that's great. Or maybe you like came over to my house with some pictures, like some slides, and you showed me like what Italy was like, right? And that was like a one-time event. Nowadays, if you're following like over 300 people, 365 people on any given year, almost everyone's going on a vacation once a year. So on any day, you're going to open up your feed and you're going to see someone going on vacation, and it seems like everyone's having this great, amazing life, and you're just stuck at home scrolling on your feed. So so it could definitely, research definitely shows that the more you scroll and the less active you are, so the more passive you are with your social media feeds, then that kind of leads to the negative mental health effects.
Yes. And one thing we talked about was passive versus active, right?
Yes, yeah.
So if you're making a post, you're engaging, or if you're just sitting there scrolling like that.
Exactly. Yeah, as a recommendation, if you're going to be using social media, get active, post, interact with your friends, and try not to get into that doom scrolling where you're just scrolling and passively consuming everything, because that's when those social comparisons take effect, and that can lead you down to a negative mood and negative mental health.
Okay, excellent. Thank you for that. So Jenny, do you think it's a public health issue?
Oh, absolutely. I had this aha moment in my early career where I had just written the American Academy of Pediatrics Screen Time Guidelines. It was 2016. Everyone I talked to was like, I'm so bad at this. This is so hard. I feel so guilty about all the screen time in my family. And I saw Tom Frieden's health impact pyramid. So he was the Center for Disease Control and Prevention director years ago. And he had this pyramid that showed at the tippy top that counseling and individual behavior change where I'm saying, hey, patient in front of me, try to control your screen time. That is the least effective on a population level, and it requires the most individual effort needed. To actually make public health improvements, you need to change the context to make default decisions healthy. That was his wording. So you can change the food environment, you can change the digital environment. And I was like, this is what we need to do for kids. We need to actually change the defaults so that it's not scroll, 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 and here's something else to make you feel terrible. You need to change that default so that maybe it like lets you go after a certain amount of time that you've preset for yourself. The default on YouTube, where so many little kids spend time, could be healthier stuff like PBS Kids, and then helping parents turn off the algorithm if they don't want it. So there's lots of ways this digital world could be designed more around kids' actual mental health and developmental needs, and that's not the default right now. And so that is where I see a public health shift that really relies a lot on policy that makes product design more aligned with kids' needs. I also want to pick up on the point of once you've gotten past prevention and you're more in intervention, we do need diagnostic codes that help us as clinicians actually identify this child is struggling with problematic media use. We're seeing this increasingly at University of Michigan. We're working on with our inpatient psychiatry service to help teens who are admitted and are struggling with their social media or phone use. And we actually don't have a billing code to actually indicate that this is a consistent problem between kids. So I hope that there is more work amongst psychologists and psychiatrists to really get some consistency around the way we can screen for it, identify it, and intervene.
The default settings are actually coming along in terms of laws. There's a California law looking specifically at addictive feeds, and it would require that the default setting be where like young people would not be fed advertisements or advertisements that were personalized to them, for instance. So there are laws that are beginning to be introduced that way. Again, will they be deemed to be constitutional? Will they be deemed to be in violation of the First Amendment? That's where the problem lies. It's not that there aren't attempts that are happening. But one of the things we didn't talk about that I think is really important is why do the social media companies do this? Why do they want to keep our eyes on the screen so long? And the reason they're doing this is because they are making enormous amount of money in advertising revenues. My research group, I work with the Harvard School of Public Health. I collaborate with them, and we did the first economic study of this that was done in the world, actually. And it showed that in 2022, just in the United States, that advertisers, we looked at the top 6 social media companies, Facebook, TikTok, Instagram, Snapchat, I'm forgetting 2, but we all know them. And it looked at how much money they were earning from kids, 0 to 17, below the age of 18. They were earning $11 billion in 1 year from ad revenues from the top 6 social media companies. But here's the kicker. For the ad revenues, the ads that were being shown to kids 0 to 12, they were earning in excess of $2 billion in 1 year just from American kids. And those kids below the age of 12 are not even supposed to be on social media unless they have parental consent. It's astounding how much money they're making. So they want to keep those eyeballs on the screen for as long as possible because it means big money for them.
Very good point, yes. And with kids, sometimes they lie about their age, right, to get them into that as well. So, and we know that it's money driven. And that's why we see influencers on Instagram, whatever, making so much money because it's advertising dollars just in a totally different way. So the guardrails, because of the DSM, they're very important. Do you think we can ever get there? And are they enough?
the legal guardrails. I think we can get there. If you asked me this question before 2 years ago, I would have been pessimistic. But the Supreme Court and the Ninth Circuit Court out in California has been, and also the Third Circuit out on the East Coast, they've come down with some really important cases, and they are beginning to differentiate between algorithms. There's many, many, many kinds of algorithms. We have the search engine algorithm that we're probably most commonly familiar with, where you just type in, show me the best restaurant in East Lansing, and it'll pop up, 10 different things for you. That's a search engine algorithm that would be protected by free speech. But the algorithms that we're talking about here, where it's continually pushing escalating content, and it's personalizing it to you. Again, what Jenny said is that's a machine. It's a computer code that's doing that to keep your eyeballs on the screen. And so it's not really about speech. In fact, it doesn't even make any difference what the speech is. The whole point is just to hold you on the screen. And that's a design of a business. It's a business practice. It's the design of the platform. And the Supreme Court, in a particular case called Moody versus Net Choice, the case wasn't about this per se, but in commentary in the case, 3 of the justices began to observe that these types of algorithms might not be protected by free speech. That's now being picked up by other courts throughout the country and used to pretty good effect. So it takes time for the law to catch up to technology, to understand it. If this was 20 years ago, algorithms were protected speech. Not necessarily. Now they're beginning to parse out what is an algorithm that might not be protected speech and what is an algorithm that would be protected speech. It's complicated.
It is, but it's very enlightening that you're bringing this to the forefront for all of us who are, we're in the trenches, right? We're learning this, and we have to give parents hope. And I think that's hopeful, that now we can take a look at, we can part and parcel out legislation and all the way up to the Supreme Court. And I think we need to give parents some hope, because they cannot, it's costly. It's costing lives. So why don't we talk about what thing would give parents hope? One thing right now in all of this.
I think our whole conversation here today is very hopeful. The experts that you have on this panel are so knowledgeable about what is happening, and what parents can do, like we were talking, was to talk to your legislators, to testify, to get involved, because that's what's going to make the real change. And there's different ways to support parents. I think if we could have more support groups for them, who can they reach out to? Some of them don't feel comfortable talking. So I know as nonprofits, we speak to legislators a lot. We're more than happy to partner with parents to speak to legislators locally.
Jenny, I'm going to switch to you. What do teens, to Andrea's very good point about what parents need, what do teens need from parents? What do teens kind of support do they need?
That's a great question, because we do hear from teens that they don't want to lecture. They don't want to be yelled at. They also know that parents sometimes can't separate from their phones or their laptops. So what they need is space to be seen and heard and listened to. So we really recommend that parents approach this with curiosity. We don't know how it felt to grow up or surrounded by all this technology, right? I grew up in the 80s, so I don't know what it feels like for my teenage boys to be growing up with the manosphere, right? So I ask lots of questions. I encourage families to carve out time. The tech companies don't deserve all your family's time and attention. So put it away in car rides, during dinner time, during downtime, where you're like, it's human time. Especially in the age of AI, we need human time where we're like, what matters to us? What are you going through? How can I help you? If you're going online to search for something, how can I help you find that thing in our community or in our, social and physical worlds around us? Those sorts of ways of trying to understand kids' drivers of being online and then finding an alternative for them really matters to teens, because then they feel seen and heard instead of judged.
That's amazing. It's an excellent point, right? And because the people that are in the room, physically in the room, those are the most important people, right? Yeah. Because we could be having 30 conversations online, and we talk about that at the dinner table. Like, this is our family time. I like that. This is our human time. What are your thoughts on that as
Yeah, I agree with everything that Jenny said, and I would like to also bring, it brought to mind something that I do talk about with my colleagues, that using a lot of the research has examined how much time people are spending on social media, and because we're talking about time right now, and the typical way in most of the research that's been done, the vast majority, they just ask people, how much time have you spent on the screen today? How much time have you spent on social media? And the reality is, though, is that human beings are very bad at this. When I do this in my own lab, we see people estimating around twice as much as they're actually using. And the interesting thing is, if you ask them, like, what do you think you're using? Let's say they'll say, like, 4 hours a day. Then you ask them, what do you think your ideal amount should be? And they think, oh, well, ideally it should be around 2 hours a day.
I was going to say, like, 2 hours a day.
And then you look on their phones, how much are they actually using?
Probably 7.
2 hours a day.
Oh, they are?
Yes. So they're actually using their ideal amount, but in their mind, they're overestimating how much they're actually using. And also because of, like, we're on a show like this talking about this, they're seeing things like this and they're having a negative opinion of their screen time. So it's almost like they're feeling guilty. They're using it. Their parents, as Jenny mentioned, parents are getting upset at them. Get your phone, put your phone away and stuff like that. So they've created a negative stigma around their phone use, and then they're not actually reaping the positive benefits of the social connections and the interactions that they can get on their social media use, because they're in their mind, they're thinking to themselves, oh, this is bad that I'm on here.
And that guilt, right? The guilt from it, to think, oh, I should be doing this instead of this, and then the human connection. Do you find that in the families that you counsel?
Yeah, I do find that the kids, like you said, there are positive sides to being online, especially kids who are isolated and might not have access to certain activities or people, that there are positive sides, that it isn't all bad.
Just to jump in, there's a lot of research on marginalized populations. They find others like them, and there's a lot of benefits.
I will say, though, that the social media companies have tried to twist that, because when they talk about regulation, they say, well, if you regulate, you're going to have marginalized populations like LGBTQ kids, and they really get a lot of information online where they might not be able to turn to their families, and if you shut this down, you're shutting down access to that. This is false. This is false, but it works on a lot of legislators, because in fact we're not saying you can put a query into a search engine and look for anything you want, keep all the content there. We're not saying take down the content. We're saying make a default setting here to be where they're not getting personalized advertising coming at them. They're not part of the infinite scroll. They're not part of the infinite autoplay videos that are coming at them. The content can stay, but just stop the feed, right? But that's not what NetChoice, which is the social media company's lobbying group, they go after this. They try and they pass this misinformation. And I think that we have to see that legislatively we can really do something, but it takes a will to do it. I think we get overwhelmed because we think this technology, I don't know anything about it, but people do know things about it, and it is totally controllable. And it's measurable. There are things we can do, like it's something called algorithm risk audits. It's model legislation. It's been introduced in Massachusetts. It might be looked at here. And you can actually measure algorithmically the harm that's happening to populations. And then that you can, with that proof, it proves the causation of harm, which then an attorney general can use to bring a claim against Meta or TikTok or whoever to say, you can't do this. This is a bad business practice. It exists. It takes a will to get it done.
And so how would you will the people of Michigan to help get that done?
Talk to your legislators. Talk to your legislators, because we are in a very fractious political landscape right now, nationally and also in several states, including Michigan. But the truth is, it doesn't make any difference if you consider yourself conservative, liberal, or somewhere in between. All of our children are being affected by this, all of them. And we need to come together to do something about it. And I think it takes everybody from all sides to be talking to their legislators and to their Congress members to do something with it.
Well, as we saw off the top of the show, with Sheree talking about her daughter and saying that this is what I'm going to do for the rest of my life so that this doesn't happen to another family. And we all know families who have been affected by this, and loss of life can be a very tragic result. So I appreciate each one of you so much today, your expertise, and I know our families that are watching Impact Michigan across the state really have an opportunity to think, and this will resonate with them. So thank you for your time. Appreciate it very much.
Thank you.
Thanks for having us.